Programming the cycler. Hospital or acute settings, standard mode. Step 1. Set up the system. Place the cycler on a stable, flat surface, such as a table or nightstand which has been cleaned. The surface should be large enough to hold the cycler and all solution bags. Place in a well-lit area. Be sure the cycler is placed at the same height as the patient lying in bed. Step 2. Clean the work surface. Wash and dry your hands thoroughly. And gather supplies. Your supplies should include solution bags, disposable set, drain option, which may include either a drain bag or a drain line extension, disconnect caps, face masks, and a patient line extension if needed. Step 3. Remove the overpouch from the solution bag. Check each solution bag for seal. Remember, seal stands for strength, expiration date, amount, and leaks. Note, if you find any problems, discard the solution bag and use another. Warning: the solution bag must be positioned properly on the heater pan. Be sure that the bag completely covers the silver heater sensor button. Additional care should be taken when positioning small solution bags on the heater pan. If the solution bag is not placed properly, overheated or underheated dialysis fluid can be delivered. Do not use external heating sources, such as a microwave, stove, electric heating pad with an uncontrolled temperature gauge, or immerse in hot water to warm solution bags. This can result in overheated solution being delivered into the peritoneal cavity, causing patient injury. Dialysis solution should only be heated by the system cycler. Step 4. Place a solution bag on the heater pan. Step 5. Plug in the cycler. Plug the power cord into the back of the cycler. Plug the other end of the power cord into a grounded electrical outlet. Step 6. Program Reset Weight in the Nurses menu. Navigate to the Nurses menu by holding down the hidden button to the left of the Go button while pressing the On-Off switch to the On position. Press Enter to access the Nurses menu. Press the down arrow until Reset Weight appears. Press Enter. Press the up or down arrow until Reset Weight is set to Yes. Press Enter to save the setting. Note: setting Reset Weight to Yes is recommended in hospitals and acute settings, where a cycler may be shared by multiple patients to reduce the risk of accidentally performing a large adult's therapy on a smaller patient, which could result in an IIPV situation. Weight is entered at the beginning of every therapy to ensure fill volumes are within the allowable range for a given patient weight. Before exiting the Nurses menu, check or verify the settings are appropriate for the patient's therapy. Press Stop to exit the Nurses menu. Press the On-Off switch to the Off position. Step 7. Turn on the cycler. Press the On-Off switch to the On position. After turning on the system, make sure you hear the beep that verifies that the alarm is working. Observe that the characters on the display screen turn on and then off for several seconds. The current mode, either standard mode or low fill mode, appears for a few seconds. In this example, we will be working in standard fill mode. When the system is ready, press Go to start appears. Step 8. Review the patient's therapy settings. Prior to starting therapy, you should review the therapy settings that may already be programmed on the cycler. Step 9. Adjust settings based on the patient's prescription. To adjust any settings, press the down arrow to change or review the setting. Press Enter to access the Change Program menu. Press Enter to change the settings. The option blinks. Press the up or down arrow to change the value. Press Enter to save changes. The option stops blinking. To continue on to the next setting, press the down arrow. Step 10. Program Therapy. The display will indicate one of the therapy types available. Therapy options include CCPD-IPD, which is the default, high-dose CCPD, tidal, and high-dose tidal. Press the down arrow to view the next option. Step 11. Program Total Volume. Press Enter to change the setting. The option blinks. Press the up or down arrow to change the value. Press Enter to save the change. The option stops blinking. The default setting is 200 milliliters. The minimum setting is 200 milliliters. The maximum setting is 80,000 milliliters. Step 12. Program Therapy Time. The doctor's orders will specify only the number of exchanges and the dwell time. To estimate the total therapy time, you will need to add 30 minutes to the dwell time specified and then multiply that time by the number of exchanges. You can verify the therapy time after the last parameter is entered and the stop button is pressed. If necessary, you can add or subtract time as needed. To change the setting, press Enter. The option blinks. Press the up or down arrow to change the value. Press Enter to save the change. The option stops blinking. The default setting is 10 minutes. The minimum setting is 10 minutes. The maximum setting is 48 hours. Press the down arrow to view the next option. Step 13. Program Fill Volume. Press Enter to change the setting. The option blinks. Press the up or down arrow to change the value. Press Enter to save the change. The option stops blinking. The default setting is 250 milliliters. The minimum setting is 60 milliliters. Maximum setting is 3,000 milliliters. Step 14. Program Last Fill Volume. Press Enter to change the setting. The option blinks. Press the up or down arrow to change the value. Press Enter to save the change. The option stops blinking. The default setting is 0 milliliters. The minimum setting is 0 milliliters or 100 milliliters. The maximum setting is 3,000 milliliters. Press the down arrow to view the next option. Step 15. Program dextrose. You can program dextrose as either same or different. Press Enter to change the setting. The option blinks. Press the up or down arrow to change the value. Press Enter to save the change. The option stops blinking. This setting does not appear if last fill volume equals 0. This setting only appears if you use a last fill. Press the down arrow to view the next setting. Step 16. Program weight units in either kilograms or pounds. The default value is kilograms. To change this value, press Enter. The option will blink. Press the up or down arrow to change the value to pounds. Press Enter to save the change. The option stops blinking. Press the down arrow to view the next option. Step 17. Program patient weight. If you change the setting in the previous step to pounds, you may now enter the patient's weight in pounds. Press Enter to change the setting. The option blinks. Press the up or down arrow to change the value. Press Enter to save the change. The option stops blinking. The default setting is 1 kilogram or 2 pounds. The minimum setting is 1 kilogram or 2 pounds. The maximum setting is 990 kilograms or 990 pounds. Press the down arrow to view the next setting. Step 18. Accept the settings and exit the Change Program menu. Press Stop to accept the new settings. Cycles and dwell time will appear. Step 19. Check the eye drain volume. If the last fill volume changed, eye drain alarm will appear. Press Stop to mute the alarm. The eye drain alarm automatically adjusts to the higher of the current value or 70% of the last fill volume. If you need to make a change to the value, press Enter. The value will blink. Use the up or down arrow to change the value. Press Enter to save the change. Press Stop to return to the previous menu. Step 20. Make adjustments. Continue pressing the down arrow until Make Adjustments appears in the display. Press Enter. Step 21. If you haven't already done so, set the eye drain alarm. Continue pressing the down arrow until eye drain alarm appears in the display. Press Enter. The volume digits blink. Press the up or down arrow to change the setting. Press Enter to save the new initial drain alarm volume. The blinking stops. Step 22. Press the down arrow to display the next option. If you are done making adjustments, press Stop to exit the Make Adjustments menu. Warning: before loading the disposable set, inspect the cassette and tubing for damage. Using damaged sets can result in contamination of the fluid or fluid pathways. Contamination of any portion of the fluid or fluid path may result in peritonitis, serious patient injury, or death. Step 23. Prepare the disposable set. Open the packaging and remove the disposable set. Close all clamps on the disposable set. The 3-prong set has 5 clamps. The 4-prong set has 6 clamps. Step 24. Prepare your drain option. For a drain bag, close the clamp of the line with the blue pull ring. For a drain line extension, leave the line clamp open. Note: when a drain line extension is used instead of a drain bag, you must leave a space between the end of the drain line and any fluid in the drain or drain container. Step 25. If you're using a patient line extension set, open the package and place it on a clean surface. In this example, we are not using a patient line extension. Warning: if a disposable set is already present in the cycler, close all clamps before you press Go. This prevents fluid from flowing from one bag to another or to the patient while load the set appears. The uncontrolled gravity flow of fluid can result in an increased intraperitoneal volume or IIPV situation. IIPV could result in a feeling of abdominal discomfort, serious injury, or death. Step 26. Press Go when you are ready to begin. If Check Patient Weight appears, press Stop to silence the alarm. Make any changes to the patient weight as necessary. When the value has been saved, press Stop to exit the patient weight prompt. Press Go when you are ready to begin. Load the set appears. Step 27. Open the door to the cycler. Push up the handle on the front of the cycler to unlock and open the door. Step 28. Load the cassette. The cassette only fits in one way, with the lines leading to the right of the cycler. Insert the cassette bottom edge first, then press in the top. Pull the lines back towards the rear to lock the cassette into the cycler. Step 29. Close the door. Press down the handle to close and lock the door. Step 30. Place the organizer. Place the long slot of the organizer over the hook at the top of the door. Press down to snap the lower slot of the organizer over the post at the front of the door. Step 31. Attach your drain option. For a drain bag, close the clamp on the short tube to prevent leakage. For a drain line extension, remove the tip protectors from both ends of the drain. In this example, we are using a drain bag. Step 32. Open the clamp on the drain line. Step 33. Press Go. The display screen changes to Self-Testing. Self-testing will take just a moment to complete. When the self-test is complete, the Connect Bags message alternates with Open the clamps. Warning: follow your dialysis clinic's aseptic technique protocol. Step 34. Close all doors, windows, turn off any fans. Put on your face mask and wash and dry your hands thoroughly. This includes instructing the patient and anyone else in the room to put on a face mask. Step 35. If you are using a patient line extension, connect it to the patient line. In this example, we are not using a patient line extension. Step 36. Connect bags. Remove the line with the red clamp. Connect the line with the red clamp to the heater bag. Connect the lines with the white clamps to additional solution bags if needed. Connect the line with the blue clamp to the last fill bag if you are using one. Leave any unused lines in the organizer with clamps closed. Step 37. Review your connections. Make sure the line with the red clamp is connected to the solution bag on the heater pan. The solution bag on the heater pan covers the heater button on the right end of the heater. The line with the blue clamp must be connected to the last fill solution bag if you are using a last fill with a different solution. Verify you have connected enough bags of the right size to deliver the prescribed volume. Step 38. Break the frangible. This is for Luer connections only. Break the frangible on each solution bag. Step 39. Open clamps. Open clamps only on lines connected to solution bags. Open the clamp on the patient line. Make sure the patient line or extension line is in the left slot of the organizer. Warning: failure to open the clamp on the patient line after connecting the solution bags will prevent the patient line from being primed. This can cause air to be delivered to the patient during fill 1. Step 40. Press Go. Priming appears on the display window. Priming may take several minutes to complete. Step 41. Priming complete. When priming is complete, the display screen alternates between Connect Yourself and Check Patient Line. Verify that the patient line is properly primed. Make sure fluid is present near the connector at the end of the patient line. Make sure the patient line clamp is open. Warning: verify that the fluid level is at or near the connector at the end of the disposable set patient line. Connecting when air is present can result in sterile air being delivered, which can cause shoulder or abdominal pain. Step 42. Get the transfer set ready. Make the transfer set accessible, but do not remove the cap until after you have washed your hands. Step 43. Prepare the room. Prepare the room for treatment. This includes instructing the patient and anyone else in the room to put on a face mask and wash and dry their hands thoroughly if they have not already done so. Step 44. Put on your face mask and wash and dry your hands thoroughly if you have not already done so. Step 45. Connect the patient. Remove the patient line from the organizer. Connect the transfer set to the patient line. Remove the pull ring from the patient line connector. Remove the cap from the transfer set and immediately connect to the patient line connector. Open the transfer set. Step 46. Press Go to start the treatment. The treatment begins with the initial drain. Ending the therapy. Step 1. Ending the therapy. The system tells you when the therapy is complete. End of therapy appears. Step 2. Press the down arrow to view the end of therapy summary information. Step 3. Record the eye drain volume. Write down the initial drain volume if required. The amount shown is the total initial drain volume from the current therapy. Press the down arrow to view the next option. Step 4. Last M drain, which stands for last manual drain. Write down the last manual drain volume if required. Last M drain only appears if you drained some fluid using the manual drain option after the last fill. The amount shown is the volume of solution drained after a last fill while using this option. Press the down arrow to view the next option. Step 5. Total UF is displayed. Write down the total UF if required. The amount shown is the total UF for the therapy. Step 6. Press Enter to access cycle-by-cycle UF information, starting with the last cycle. Press the down arrow to continue accessing cycle UF values. You can view up to 29 cycles. Press Stop to return to the previous menu. Press the down arrow to view the next option. Step 7. Dwell time is displayed. The average actual dwell time for the therapy is shown. To review cycle-by-cycle information, press Enter. Press Stop to return to End of Therapy information. Press the down arrow to view the next option. Step 8. Dwell time lost or added is displayed. The amount of dwell time lost or added is based on the estimated dwell time calculated at the beginning of the therapy. If the lost dwell is 30 minutes or longer and you have not viewed this information, The system beeps and displays the lost dwell time. Press the down arrow to view the next option. Step 9. Manual drain is displayed. Press Enter to select Manual Drain. Press the down arrow to view the next option. Step 10. Alarm log is displayed. Press Enter to review the 20 most recent alarms. Press Stop to return to the previous menu. Step 11. Review and record the end of therapy summary. Step 12. Press Go. Close all clamps appears. Close the transfer set. Close the patient clamp on the disposable set. Step 13. Close all remaining clamps. Step 14. Prepare to disconnect. Close all doors, windows, and turn off any fans. Put on your face mask and wash and dry your hands thoroughly. This includes instructing the patient and anyone else in the room to put on a face mask. Step 15. Open and remove a new MiniCap disconnect cap from the package. Step 16. With the tip of the transfer set pointed downward, disconnect the transfer set from the patient line of the disposable set. Place the patient line back on the organizer. Step 17. Immediately place the MiniCap disconnect cap on the transfer set. Tighten the MiniCap until fully secured. Step 18. Press Go. The display alternates between Close all clamps and Disconnect yourself. Step 19. Open the door. Remove and discard the disposable set and solution bags. Step 20. Press Go. Turn Me Off appears. Step 21. Press the on-off switch to the off position.